The two approaches that we have available to us for your valve problem would be called symptom management and transcatheter aortic valve replacement. We are not going to talk about open heart aortic valve replacement today because you've already seen a surgeon and that's been deemed too risky of an option for you.
I'd like to make a decision with you. I'd like to share that decision process with you because I'm very knowledgeable about the procedures and about the risk of complications, but I'm not an expert in what your values are. You're the expert on what's most important.
So in deciding between these choices, we have to focus on several different aspects. How you might feel, what risks you take up front, and what you might expect down the road.
At 1 year from now, what are the things that are most important?
That's what I'm looking for out of life. I want a normal life back again.
Am I understanding you?
That's exactly it.
Since we've gone through the details of both
Yes.
choices and
Yes.
given your goals, it does seem to me
That
to be
would-
reasonable to think about this option for you.